Doctors of Reddit, what is the most bizarre issue you've seen a patient trying to hide or mask? Oh, I have tons of weird stories. When I was a 4th year medical student, doing a rotation at the Veterans Administration Hospital, the patient came to the emergency room complaining of stomach pain. We did an x-ray, which showed 2 toothbrushes in his stomach. He explained to us that he had the sensation that there was something on the back of his throat, and used his toothbrush to try to get rid of it and accidentally swallowed the toothbrush. The same thing happened with the second one. We consulted gastroenterology, and the toothbrushes were removed via endoscopy. He was admitted to the hospital for observation overnight. The next morning he complained of stomach pain again. A follow-up x-ray revealed that he had swallowed his entire convenience kit at the hospital, including the small toothbrush, small tube of toothpaste, and even his plastic razor. Needless to say, we called psychiatry for consultation. It turns out this was not the first episode for this guy. He just liked to swallow things. Not hidden from us, but from her boyfriend. Came in with $9,000 in cash which he had wrapped in plastic and shoved up her hoo-hoo. Her fanny acids disintegrated the plastic wrap and she had to be anesthetized to get it all out. I hope it was in 50s and 100s. I know fannies are stretchy, but that much in small bills seems like it would be pushing it. It wasn't the patient, but his butthole relatives. They came into my office to ask me to see this old guy because he had accidentally cut himself and wanted some stitches. I told them I couldn't do any stitching, lack of sterile equipment, but would have been glad to apply some steri strips if the wound allowed it, as long as they brought the man in the office. Request denied. They kept insisting I see the man at home. Fine. I loaded up my bag to go check on the old fellow. I found him in his bed, conscious but refusing to talk, with various superficial knife wounds on his stomach and a gigantic hematoma in the process of swelling up on his forehead. I flipped my crap and got the relatives to finally talk. They said the man had fought with his sister and decided to self-harm by repeatedly slamming a hammer on his forehead, had then tried to disembowel himself with a kitchen knife. They didn't call an ambulance because they were ashamed and didn't want to deal with assisting the man in a faraway hospital. I gave them 15 minutes to get their crap together and either call an ambulance or get the man to the hospital themselves. Never knew what became of him. Sounds to me like the sister did it to him. I had a lecturer who told me about a homeless guy who regularly presented to ED claiming stomach pain. He would get an abdomen x-ray which showed a bunch of wire inside his abdo. He would be added to the next day's emergency theater list, get a hot meal and a bed for the night before hooking it the next morning and self-discharging before surgery. He had purposefully pierced his belly with a wire coat hanger and fed the thing inside himself so he could go around to hospitals and score a free hotel room for the night. This is somewhere with universal healthcare, so even though he was a regular and the hospital staff knew him by name, they couldn't refuse treatment and couldn't force him to have the coat hanger removed either. I'm kind of wondering why they're feeding him prior to surgery. Usually it's nothing by mouth. Sent a male patient into the bathroom to collect a urine sample. Took him much longer than expected. He misunderstood and gave a semen sample. I swallowed 3 razors on a bet. After we saw how many he'd ate. Okay, it was 8 inches. After visit with psych doc. Okay, it wasn't a bet. Sorry because English is not my first language. I'm a neurologist in Spain. We were brought a patient with an acute stroke in the morning. Asking him about how it happened, he said he had gone out for an early morning jog when he fell down unable to move the left part of his body. An hour later a nurse asked him the same question and he gave another different fake answer. It turns out he had woken up early, left his house, and he was freaking a prostitute when he suffered the stroke. It was this woman who called the ambulance. The tough part was meeting his family. Had this dude when I was a medical student while on surgical service. Got consulted on priapism. Asked the dude how long he had erection. etc. And he just said yeah, his dong hurts. Not sure why blah blah blah. Then examined him. And dude's dong was quite literally a cauliflower of warts. Turns out, he had HPV and HIV, and didn't take his heart meds, and this isn't the first time it has happened. Cleared up after starting to take his heart meds previously. 2. I've got one. I had my nose straightened and septum shaved after I broke it like a dumbass. I woke up after anesthesia feeling like the fricking man. After about a minute of being awake, I tore out my IV, stood up, and started walking out of my room because I was going to walk home about 3 miles and finish that one mission in Heroes of Might and Magic 3. I walked past a nurse and she said, "You're bleeding." Haha, no, I feel amazing. I respond. I keep walking until I get to the elevator and I see my reflection in the metal. My face is bandaged up with black bruising leaking out from under the white fabric. My eyes are bloodshot, and I generally look like crap. No matter. I wake up some time later, back in my bed with the IV inserted in my other arm and I am strapped to the bed. Turns out, I was on a morphine drip. That's why I felt like Superman. My parents start yelling, "I am like, what you flimmin' walkin' but." Turns out, I gave myself a concussion when I collapsed while waiting for the elevator. On the bright side, that is how I found out painkillers were amazing and that they would help me survive a year of intense manual labor when I ran away from home. On the downside, I was addicted to painkillers. One time I was in a car accident and in the ambulance they gave me morphine because my collarbone was broken and I was pale from the pain. The pain almost instantly disappeared and I fist bumped my cousin who was riding with me after telling her that this was the best day ever. Not a doctor. On Thanksgiving I had a pain almost literally in my butt, but more toward my perineum. Ingrown hair abscess type thing. Went to the since it was a holiday and I could hardly sit. When they asked what was the issue and where it was located, I said in a sensitive area. When they pressed further I said my perineum. Oh, the nurse replied, "Your taint." We all had a good laugh and I had my taint lanced. We did about $1 bajillion workup for syncope, fainting, on a woman before realizing it her boyfriend was beating the crap out of her. The smug look on his face still kind of haunts me years later. From a doctor friend. In Provincetown, a man came in complaining of severe burning pain in his urethra, even when he wasn't peeing. Doc couldn't find any reason why, and the guy couldn't provide any. Finally asks the guy what he does. He says he works at a popular gay bar where, oh, he does champagne shots. That's when you fill your pee hole with champagne, then get up on the bar and pee it into the mouths of paying customers. He did dozens every night. Not a doctor, but I'm sure the doctor would tell it. TLDR had an infection and had a hands-on experience I won't forget. I was 12 and I had an infection in my scrotum and tried to hide it hoping tea would just go away. I was walking funny and it eventually turned purpley. My parents got very worried and spoke to me about why I was walking funny. Finally had to show my mom my crazy swollen purple testicle and we went to the doctors the next day. While there I explained the situation. They needed to do tests so I was given morphine and so they could ultrasound my nads. There was a super attractive nurse doing the ultrasound too. She got clear jelly all over my balls. It still hurt, but man, if that wasn't one of the first rock hard erections I ever had, I don't know what was. I was so weirded out by the whole situation. First I get an infection in my balls. Then I'm given morphine. Then get jelly slathered all over my balls. Then I see one of the prettiest girls in my life and she touches my disgusting morbid sack. I tried desperately hard not to smirk because it still felt kinda good, also being ticklish, but every couple seconds I would giggle and smile, but then a quarter second later it would hurt and be painful. So it was a roller coaster, especially for being so young. It went on like that for at least 5 minutes. Don't really remember what the problem was, but if I recall correctly I had a bacterial infection. But it cleared right up and I was fine. I think the only lasting effect from that was that women with short hair are still very attractive to me. Doctor and nurse, if you're reading this, thank you, but holy crap was that confusing. First I get an infection in my balls. Then I'm given morphine. Then get jelly slathered all over my balls. Then I see one of the prettiest girls in my life and she touches my disgusting morbid sack. Dude, say no more. Well, I'm a radiographer and sometimes you see those objects stuck deep inside patients. I've seen a spray can, a screwdriver, a potato, a corn cob gone way too far, but the more surprising one was a woman that used a Coke 33 centiliters glass bottle as a corn cob, and she didn't have enough so she used another. I guess she felt nothing due to excitement cause she pushed the first bottle into her uterus, breaking the cervix by pushing with the second bottle. When I was a med student we had a guy with a rolled up newspaper, Sunday's paper, quite a massive thing. in his rectum. We stood around the x-ray laughing when another student said that he couldn't understand how someone can swallow a thing of that size. He was totally earnest and probably the most naive person I've ever met. The 10 inches long cucumber the male patient had placed in his rectum, which was distending his abdomen on the other side. PT said nothing until CT showed the mass. Oh, you mean that cucumber? Not a doctor but watched them with a man while in the air. Guy walks to the back with a couple of towels on his shoulder. Looks like blood is starting to seep through. Nurse, what happened? She starts to take the towel off. Her face turns from a smile to very serious. Calls over the doctor and others. Guy, I was cutting some branches overhead with a chainsaw. It got caught on one of the branches and came back on my shoulder. By now, there's a crowd around the man and they are getting ready to take him back for surgery. He had basically cut into his chest with a chainsaw. Not life-threateningly bad at that point since he walked in. I was in awe to be honest. I always wondered how he shut that dank thing off before straight murdering himself. A lot of chainsaws have a chain brake which activates automatically when there's kickback or under other conditions of fuckery. Not a doctor, but a friend is. Patient very hesitant with what was actually up, so went for x-ray. Unmistakable shape of a Barbie doll up his ass. So, emergency surgery, and it's removed. He comes to and sees his wife at his bedside. He panics, and when she goes to the ladies, asks the nurses not to tell her what's happened. She comes back in, and one of the nurses brings back the crap-smeared Barbie doll in a small plastic bag. Wife glares at him. I fell on it. What an butthole nurse. In the summer my brother and I used to spend our time in the backyard looking for caterpillars and frogs. Given I was 4 years old and did not know what I was doing, I thought it would be funny to put a caterpillar down my 2-year-old brother's swim trunks. He didn't feel the caterpillar go down his swim trunk, so I didn't get the reaction that I wanted from him. So I just forgot about the whole thing and moved on. Later that day when my mom was changing his diaper, she screamed and saw all of these spikes in his butt that he must have got from the caterpillar from when he sat down. Turns out he had an allergic reaction to it and we had to go to the doctor to get all of those spikes out of his butt. Lady presented multiple times requiring admission for systemic infection found to be a weird amoebiasis. Its docs were very confused. This was in the middle of a US suburban area. She was drinking her fish tank water to get sick. Morbidly obese lady came into the ED altered and obtunded, kept responding to Narcan then getting obtunded again. 3 fentanyl patches eventually found hidden on the undersides of her pendulous breasts. Prostitute with a murder kit including a large wire garrote, 4 knives and various poisons in her handbag. And of course the guy who came in from jail in excited delirium with an uncomfortably large quantity of methamphetamine hidden up his butt. Physical therapist here. Treating a patient with a traumatic brain injury post-car accident. Was just getting him moving when I noticed he kept picking at his beard and then putting his fingers in his mouth. Couldn't see anything he was physically eating. Figured it was some sort of tic after the TB. Wrote it in my note and sent it to his physician. Looked in the note the next day before his visit and saw that they had discovered he had brain matter and cerebrospinal fluid leaking out of his nose and he was eating it. It was clear so I couldn't see. When I was in the hospital, there was a homeless man that was beyond drunk. This guy was next level crap. He had 2 doctors, 3 nurses, a cop and an orderly trying to keep him restrained. He thought he was forming coherent sentences, but the words "I'm not fricking drunk" came out several times, along with "I don't even drink alcohol." IT was rainwater. They kept telling him they would sedate him if he wouldn't stop his wild behavior. They couldn't because of his bowel. Every 20 minutes he would get riled up again and same crap all over again. Eventually, he admitted to alcoholism and the cop left and 2 doctors looked after the man. Dude even ripped out his IV. Anyone can rip out an IV. What's impressive is seeing a man rip out an inflated Foley catheter. I did an internship with a doctor, dermatologist, and she told me that one day a homeless guy came to the hospital with a bandage on his foot and saying it was painful. The nurses were afraid to take care of him because of the horrible smell and discover what was under the bandage. The dermatologist was called and she did it herself. When she opened it, the foot of the guy fell off. He got an infection and larvae started to eat his foot. Sorry for my English. Semi-rotten sandwich found lodged within the folds of an heartbreakingly obese patient's panniculus during an emergency procedure count. Pregnancy. Patient arrives into a tridge. She is in her early 30s and was complaining of lower abdominal pain and nausea. The British tridge nurse, who tells this story best, says the poor woman was bent over double in her chair. From all accounts, she was a relatively skinny individual. In order to make sure there was no emerging emergency, our tridge nurse has a peek at the patients downstairs. She was greeted by a crowning baby. The nurse bolts up and runs into the ER and grabs my attending. Sir, she's up the duff confused. A brief who's on first exchange ensued before my attending and I ran in, just in time to catch a healthy 8 pounds baby. There are several other incidents similar to this, but none so pronounced. Mother denied being pregnant up until the moment her baby girl was on her chest. TL. DNR. Duff denied. Nurse pried. Mom lied. Baby cried. My best friend's mother is a nurse. Since we've devolved into tell whatever story. One night, as a joke, he decides to show her one man, one jar. Hilarious thing to watch with your mom, right? Anyway, this woman deadpans the entire video and follows it up with, "Oh, is that it? Okay." Dumbfounded. We ask what she could have seen that could possibly be grosser than that, right? She proceeds to tell us, in detail, about a man who stuffed a hamster into a condom, then shoved the rat bag up his butt. The hamster then, out of suffocation, chewed through the condom, clawed its way deep into the rectum, where it drowned in a mixture of blood and crap after shredding his colon in a frenzy. Like some fucked South Park joke. She was part of the team that had to retrieve it. His mom always seemed like the demure housewife, but damn, that lady has seen some crap. I had a patient who, instead of treating her choice to have artificial donor insemination as an empowerment move, had everyone else convinced that he had a deadbeat dad who took off when he was born. She felt that this made her look empowered because she stood up as a single mom. The now school-age kid knew but was horrible at lying. When I asked him what life was like at home, he said something along the lines of good. Just me and mom. She's a good mom. Pretend dad ran away. There was no real dad though. What the frick, mom? Sister's friend is a nurse and told the story of a man who came into ED clutching his abdomen and complaining of severe abdominal pain. He was acting suspicious and kept changing his story, symptoms, site of the pain, etc. Sister's friend and a few other nurses suspected something wasn't right, and after maybe an hour or so, he confessed the true cause of his pain. He had inserted a deflated full-size basketball, note, a very cheap one, into his butt and pumped it up. Amazingly, he somehow managed to pump the ball up to the point where it popped inside his butthole. The popping is what had caused his pain. But the kicker was this: he hadn't come to the ED to treat the pain. The basketball was still inside his butt, and after the pop, a combination of pain, presumably swelling, and it still being semi-inflated had meant he was unable to retrieve it himself. She didn't go into detail as to how the basketball was retrieved, but I can't imagine it was pleasant. TL. DR. Dude put a basketball up his butt and inflated it until it popped, and he was unable to retrieve it himself. There is just no way you could pop a basketball inside your butthole. No way. May I answer as an RPH who has worked with pharmacy clinics? About 7 years ago, just a few years into being a pharmacist, our community pharmacy decided to put in one of those urgent clinics. Cheaper than an ER, more accessible than an urgent care. A young woman with a broken, misshapen face enters. My first mother bear instinct was, oh god, her boyfriend beat her. I know that is a really horrible conclusion to jump to, and I felt bad as soon as I thought it, but at the time what I saw in front of me was a young woman with blood-streaked brown hair, holding a broken nose. Her eyes were puffy and purple. I take her to the back room and I snag the nurse and have her start helping with cleanup, and I wait to see if I should call for a dispatch. Nurse tells me a few minutes later not to bother. The woman had not been in a fight. She had not fallen. There had been no car accident. She wanted to slide down her staircase on a mattress and smacked into her front door. It took 4 hours to find out because she refused to tell anyone, and when the police threatened to put her butt in jail, she confessed. Side note, after 3 hours of being monitored for cranial damage, the police dispatch was called. They were trying to get a statement, even a nothing is wrong. She did not say one thing or another, just refused to answer. So they told her, tell us or we will have to hold you for obstruction of justice. I do not know the law in this sort of situation, but one of the nurses told me that when it comes to public safety, the cops have to find out if someone is about to enter a dangerous home, note it and give her help information. Even if a boyfriend had hurt her, she did not have to press charges. So I do not know anything about that and cannot comment further. Another one at the same clinic. A man came in who had decided to see how many fish hooks he could put into his skin around his hand. The fish hooks were still attached to wire that his cat wanted to play with. Several of them ended up embedded into his hand tissue. I do not think he still has the cat. Oh, there was the woman who came in with something lodged in her ear. I do not know what it was, but the doctor had to go into my office to laugh. Number. Get out of here. Only one type of healthcare professional exists. This story came from a nurse I was good friends with. She worked at a metro hospital and this was her most memorable one to date. Couple goes to her. The lady of said couple comes in complaining of a rash around her colostomy hole and she is very concerned. They do a few general tests and take a bacteria sample to the lab. When the results came back, our friend had to deliver the news to the couple. Turns out the rash was chlamydia of the colostomy hole. Now I will give you a minute to let that all sink in here. Okay, so this led to the following breakdown of events. It was now discovered that the couple were engaging in physical intercourse in her colostomy hole beyond the normal areas of choice. The lady also later checked out to not have said chlamydia of her genital area, therefore leading to the discovery that her man was cheating on her and brought her home a gift from his other lover. Man, some weird butt crap goes down in the Motor City. Worked on an ortho trauma unit. Not sure we'll ever know what really happened, but I have a feeling this patient was on some serious drugs at the time of his injury. Came in with a femur fracture after he reported running from a raccoon into a telephone pole. He must have been one heck of a runner to gain enough speed to break his femur. Nurse report read man vs. Raccoon. Also the 70-year-old male that fell onto the glass Coke bottle up his rectum. Made for a cool X-ray. Possible new ad campaign. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.